The Dental Download podcast is your source for insight into dental school, conversations with dentists, specialists, and leaders in the industry. With new episodes every Monday morning, I'm your host, Haley Schultz. Let's get into this week's episode. Want to make a podcast? Spotify's got a platform that lets you make one super easily and then distribute it everywhere and even earn money, all in one place for free. It's called Spotify for Podcasters. Here's how it works. Spotify for Podcasters lets you record and edit podcasts right away from your phone or computer, so no matter what your setup is like, you can start creating today. Then you can distribute your podcast to Spotify, but also everywhere else podcasts are heard. Video podcasts are also available, and you can earn money in a variety of ways, including ads and podcast subscriptions. Did I mention it is totally free, no catch? I've been using Spotify for Podcasters since the very beginning of my show, and now we're nearing our 200th episode, so I can definitely say it's an easy platform, and I've really loved using it. So be sure to download the Spotify for Podcasters app or go to www.spotify.com/podcasters to get started. All right. Hi, everyone. We have another guest here today, and I'm going to let Richard, do you go by Richard? You go by Richard. Introduce himself.
Yeah. Hey, everybody. I'm Richard Worsham. I'm currently a D3 at Creighton University School of Dentistry. Trying to think where to start exactly. So I have a weird kind of history to get into dentistry. So after high school, I went on what's called an LDS mission for 2 years. So I went to South America. I was in Paraguay, Argentina, and Brazil for 2 years. And then I came back and I actually played college basketball at a small university in Utah called the University Utah Eastern. After about a year and a half playing, I had a pretty bad injury and I tore a tendon in each ankle. And at the same time, I met my wife and needed something to tell her father that I was going to do in order to convince her that he wanted to let her marry me, more or less. Anyways, so I just had a kind of a moment of clarity, and I realized I wanted to go to do dental school. So I transferred to the school she was at, which was at Brigham Young University, and then I applied to dental school 3 years later after rushing through undergrad, and ended up at Creighton, which was not my first choice, but will turn out to be one of the best decisions I've ever made. So
that's awesome. Yeah, that's kind of why we're here today, is to compare and contrast dental school experiences a little bit. That's why Richard reached out to me, and I think it'll be interesting for everyone. But in terms of your 3 years of undergrad, so once you transferred to BYU, that's when you started pre-dental things?
Yeah, so a bunch of my credits didn't transfer, which was unfortunate, but it was okay. At that point, I had gotten married and I was just ready to focus on doing dental school, and got a job and even paying my way and all that good stuff. So yeah, I did it. I went to school full year for 2 years, and then the third year I took the summer off to study for the DAT. Took the DAT and applied, and then graduated the spring of 2020. So
do you have any reflections from your application cycle? Any regrets? Anything you would recommend to people? Anything like that?
Oh, that's a good question. I'm trying to think of good advice for that time. It's been so long. I think I've kind of erased part of my memory about that because it's so stressful. So I was taking 15, 16 credit hour courses. I was trying to finish up real quick. And which probably wasn't a good idea, especially the last semester right before the DAT. But at the same time, I was doing DAT boot camp, and I would get up at 5 a.m, go to school, study for 2 hours, and then go to class in order to make time. And then in the afternoons, I'd go to work. And so I had to make time to study DAT boot camp when I was at school. And I did that for the first month and a half. It was March, April. And then kind of all, COVID lockdowns, all that good stuff happened. And so I actually didn't walk because they didn't do anything for it, which was perfect for my prep. Well, No, actually, that was the year before. Oh, that's year 4. Yes. Sorry. I'm jumping ahead.
That's okay.
That's so just 2019. 2019 was I finished the semester. I had 3 more weeks of study after the semester ended, took the DAT, got my score. I saw it. I was like, good enough. And I applied to schools. If I had to give advice on it, I think the application process is so unique to everyone. I was told my entire undergrad experience, just apply to tons of schools. Apply, throw kind of a wide net. What you don't want to do is you don't want to not get in somewhere the first rotation. And I did not have the most competitive grades, I guess, because of basketball. And so the credits that did transfer were fine. They weren't bad or anything, but they weren't all A's or anything like that. And so I was a little worried about that. But I would say if I had to do it again, what I would do. So I applied, I think, to 17 schools, I think.
Wow.
Which is quite a few. And I got quite a few interviews. I think I got 4 or 5 interviews. And I only went to 3 of those interviews. One was Creighton, the other was Roseman, and then Indiana was the other one. And I went to all 3 of those. But what I would recommend actually is I think I would have applied to less. Not because I think a lot of people are concerned about the financial issues, but for me it was more. There were several schools I applied to that were kind of like dream schools. I mean, actually, Michigan was one of them that I applied to and didn't get in. And I think, looking back, that it was a fun idea. It was a little fantasy in my head of going to Michigan to be kind of cool. I had a brother at the time that was living in Michigan, but I think there's some schools I would have knocked off the list, and I would have just been more wise about my decisions.
Yeah.
And yeah.
Yeah, I had similar. Like there was a couple schools I applied to, even though I knew either they were a reach statistically or like you can see how many in-state, out-of-state people accept and whatnot. And even though I knew like UNC, for example, didn't take out-of-state students really, except for a few, I still applied there because I was like, oh, it would just be so cool. But that's like such a just waste of time and money and energy. And then on the flip side, I felt like a couple of the schools I applied to, I also could have knocked off because they were kind of like safety schools. And from my experience and my peers as well, it seems like those schools don't actually interview people if you're like well above their like normal range also. So like there was schools, it's not the same as applying to undergrad is kind of what I tell people. Like it's not like you're accepted to the places that you're above statistically. They know you're not going to go there. So they want to give their interviews to people that are actually in their range. So you really want to be like spot on with like percentages of in-state, out-of-state, your actual statistics, your kind of application values, all that. Like you really want to be more selective with it. I agree.
No, yeah, I'm totally with you. I think there's a propensity to reach and also just make sure that you have a little bit of a kind of a nest egg in case there are issues. And I think you should just kind of if you're like you should look at the statistics, and if you're in that range, feel confident in applying those schools. But you're totally right. I think I didn't have a ton of schools that I was over achieving in, but I think there were 1 or 2 that I can think of right now that like I had no intention to really go there. I'm sure if I had not gotten in anywhere else and had just gotten into those schools, I would have, accepted and I would have gone, which would have been great. But I didn't even get interviews or acceptances to those schools, right? Because those schools were also more selective, and they knew that if I got somewhere else, that I wasn't going to go there, right? I mean, Iowa was a good example of that. Actually, I really wanted to go to Iowa. My wife is from Iowa, and we ended up close. Creighton's not too far, but I was so excited about going to Iowa, and I never even heard back from them ever, right? And their out of state was, I think it's like they have 105, 110 students, something like that. Out of state's like 3 or 4. Like it's just teeny tiny number. There's really no way that I would have ever gotten in. I would have had to have been statistically perfect, and that definitely wasn't me. So I think, but I wish looking back, I had enjoyed the process a little more. I think there's a lot of pressure to make sure you're getting somewhere, and you don't want to be too greedy about it. But when you get into dental school, at least this is how I feel now, is I am one of 110, 100, whatever, how many in my class, and we, I'm going to be part of this elite group of people that can do really awesome things for patients. And, in a year from now, we're going to be able to kind of have a pick of where we want to go work and who we want to be around, and really where we want to live to some extent, right? I mean, if I wanted to go to Michigan and, in 2 years, there's a good chance I can find a job somewhere in Michigan, right? That's not something you could say about every job. And so I think getting into dental school, like when you first get in, you're just grateful to be somewhere. But I think taking a little more pride in the fact that, you are already, like, if you're applying in dental school and you're getting in dental school, you're already part of this upper echelon of people that have done really well, that work really hard, and you're going to continue to work hard and you're going to refine yourself. So I wish I kind of would have enjoyed the process more. Like, I when I went to Indiana, I remember just being like so nervous, and I remember like just like didn't talk to anybody, and I'd be like going to my hotel room and just kind of like bunkering down and being like, just like I was so scared the entire process. And I think I wish I enjoyed, traveling. Like I'd never been to Indiana at that time. I wish I enjoyed traveling to Indiana, being there, and just enjoying being with people. And that's something that I would change if I could go back.
It's really good advice too, because it's easy to just be so focused on what's next. Will I get in? Where am I going to go? Instead of just enjoying the fact that you got the interview, making the most of it. And also, I just thought it was fun, like seeing your application all together, like all those experiences, all those hours, all those things you did, like seeing it come together. Like people should really take a step back and be like, wow, like all my hard work is in this application portal, and I'm proud of myself no matter what happens.
Well, it's a massive achievement, regardless of what happens. I mean, there are people much more qualified than I was. I mean, I had, over 100 hours shadowing, I had leadership things. I had, all my grades. Like, I mean, this is a culmination of, 5-7 years of your life. I mean, going back, like, I mean, even like dipping into some of your high school experiences are really part of this, right? And so, yeah, I mean, it's awesome. I mean, you do it, you feel, just totally accomplished. You feel like you've arrived to this thing. Yeah, I recently saw not D1. He's applying. He's going to try to go to Creighton next year. I was talking to him. He was at Creighton. I walked down one of my classes with my friend, and I saw him there sitting there. And we asked him, did you just do your interview? He's like, yeah, I just did my interview. And he was telling us like how nervous he was. And I was like, I remember that. I remember being this like so stressed, right? You just want to get in somewhere. You just want to be accepted. And I totally feel that. I understand that. But looking back, it just seems so trivial now. And it's easy to say that, now that I'm here and it's been 3 years I've been in school. But I wish I would just enjoyed like, this school thought highly enough of you to bring you out, right? To ask you to come to see the school because they think you're a good candidate. Like that's something to be proud of, something to have, to be like, oh, okay, like I can actually do this, and having a little more confidence in yourself. I mean, dentistry really is just about confidence at the end of the day. And so I think that would have been, good for a younger Richard to hear.
Yeah, that's super true. So when it comes to Creighton, I don't know if you were choosing between other schools or Creighton was the only option, but what about the program initially were you excited about?
Ooh, that's a great question. So Creighton has a great reputation for being very good clinical school. I've talked to many dentists, and not many that actually came from Creighton, but just had worked with people from Creighton. They always said that the clinicians that came out of Creighton were very good. They said they were really well-rounded. They could do a lot of things. And part of that is, we kind of mentioned about this before the show, but part of that is there's no specialty programs at Creighton. And so any cases that come in the door go straight to the students. Now, there are specialty programs around Creighton. So, for example, there's an oral maxillofacial surgery, residency at the hospital near us. But that's like, okay, like that person's also in medical school, right? They're not just extracting teeth. And so, twice a week they come in and they extract, they do really complex cases where someone's been under, IV sedation, they have nitrous as well. They're doing all these things to kind of, take care of this patient. And that's one patient that I'm not sure I want to see right now anyways. And so that's fine. That's not a big deal. But being able to do a full mouth extraction, I think that's something very unique. And being able to, I mentioned this before, being able to do endo, right? To do a full case of endo yourself is something that, Creighton offers. And it was very appealing. It also just felt right. When I went to the other interviews, it just didn't feel like it's where you're supposed to be. And I'm sure you quite had a similar feeling about Michigan, where it's just like, maybe I just want to be here. Like and Creighton kind of called to me. Like I mentioned, my wife is from Iowa. And so Creighton kind of put us close to Iowa. That was really good. but it just felt like a school where I could, progress and move forward. And that clinical aspect really made a big deal to me because I have a very strong drive to be very good a clinician. So the idea that you can kind of take the ropes off of a student and let them kind of run and figure things out was very appealing to me. And it's very nice now that I'm actually in clinic, because the last 2 years, obviously I haven't been. But looking back, I think that was the big thing, was the clinic aspect.
Yeah, I mean, we talked about this, like you said, before we started recording, but it's just so different from school to school. And our school, because we have all the specialties, is great if you want to specialize. And I'm not saying don't go here if you want to be a general dentist, but like you're just getting a different experience. And as we were also saying, every single student at every single school gets a different experience too, because they're not evenly distributing every type of procedure to every student. It's like whatever's in your patient pool. And that's the work you have the opportunity to do, or in my case, opportunity to do, or maybe have to refer even then. So like we've been in clinic since May, and I've done 3 restorations, and I'm delivering my first crown tomorrow. Most people graduate doing 1, maybe 2 endo, and I haven't done any denture actual like start to finish cases yet. So for a lot of people, I've heard similar things, that like you start off pretty slow early 3rd year, and you might start getting your complex patients kind of around this time, and then start working on those plans through the end of 3rd year and even lingering into 4th year if it's like extractions and then healing and then pros and all this stuff. So I've gotten a couple new patients where I see that happening, but it's just a slow process. And as you know, the patients aren't guaranteed to always be there to continue with treatment. So just because we planned this extensive year-long plan doesn't mean they're going to show up for it. They're going to want to pay for it. They're going to go through everything, because a lot of people come in and they're in pain, and you're able to address that pain, and then they don't come back, even though they said that they want to start taking care of their dental needs. But now that they're out of pain, I don't really want to deal with it. I hate the dentist. And then they come back months later in pain again. And you're like, well, we could have kept all these teeth, but now more need to be extracted because you have more decay or whatever. Maybe not months, maybe a year or whatever. But it's just, dental school is interesting. I'm sure you see similar situations in private practice too, but it's like another level at dental school, I think, because we have the reduced fees. So you're just kind of attracting different patients.
No, I totally agree. I was smiling that whole time because I was thinking about, I saw a patient maybe a week ago, 2 weeks ago, and she came in, she was referred for a bunch of endo, bunch of crowns. And I was like, oh man, this is like a coal mine. This is the dream. And brought her in and, did my exam, kind of opened her mouth up, and I was like, oh my goodness, like all these teeth are just bombed out. And there's decay everywhere. They look really, really rough. And I knew immediately, I was like, there's not endo happening on these teeth. We're going to have to extract these teeth. Like, it's going to be extractions. She was like, we can't save any of them. And I was like, you don't understand. Like, I can see like your roots on all your teeth. Like, there's so much recession. Like, and after talking to one of my professors, he was like, oh yeah, that's a C over C case. Like, that's a complete denture over complete denture. Like, you got to extract those teeth and put a denture in. And so I was like, hey, are you in pain? She's like, yeah, I'm not in pain. I'm in pain. So why don't we do the extractions? And she, I mean, I'm sure you're aware of this, but like extractions at dental school are very cheap, right? Like almost like criminally so. They're so cheap. And she saw the price. Like, so I was like, hey, let's do the extraction. She's like, okay. We stood up, we were walking back to schedule her an oral surgery. And she turned to me and was like, that's the price? And I was like, yeah. She's like, I can't do that. She walked out. And I was like, what the heck? Like, she was talking about how much pain she was in, how comfortable she was. And she just was like, I can't afford that, which I totally understand. But it's funny because she come in for crowns and endo. Like, what did she think was going to be the cost of these other extractions, right?
In comparison. Yeah, it's crazy. I'm curious, because you were saying you can pretty much tackle whatever comes into clinic. How did your pre-clinic training work? Like, what did you do first and second year when it comes to labs? Because ours was, I'm assuming, pretty different.
Yeah, so I don't know a ton about other schools. This is one of the reasons why I've enjoyed listening to your podcast, is because it's been interesting to hear the process. So our first year was almost all just coursework. Like it was just lectures. There was a decent amount of, doing class ones. I don't think I actually tackled the class two until the beginning of my D2 year, I think. If I'm not mistaken. We did class, some class fives, some class ones. We made a full, and I'm not sure if other schools do this, but this is like one of the things that bothers me about Creighton, is our first course was dental anatomy, and you had to carve teeth out of wax.
Waxing's the worst. I'm still so bad at it.
So it's a nightmare. And they had you carve, like they gave us these big pieces of wax. And you had to carve like anatomically correct, like, like proportionally sized teeth. And I actually have one, but I think I have them upstairs. I have my teeth still. And like you have to like carve like a maxillary first molar with a palatal root, mesodistal roots. And you had to like place the furcation in the correct way. You had to be shaped correctly. Horrible class. And I remember to that class, I for sure got a B. And I was grateful to get out of that class. It was so hard. And I remember coming home being like, I can't do this. I just can't do dental school. It's so hard. So like we had a couple of lab courses, but the majority of it was like lectures. We had anatomy, we had histology, microbiology. You had, essentially all of your senior level courses that you took your last year or second to last year of undergrad, you took again in dental school, right? They're all just together. Right? So biochemistry's in there. Physiology, all that good stuff. And so that was like the full first year. And then kind of pittering out the end of the first year, you start adding more courses. So we had operative was added. I think we started doing, we talked, like we just took an occlusion course, which made no sense at the time, but looking back, I'm like, oh, that's what they're saying. But so then, starting in the second year was like, you kept the same amount of didactic and you just threw you into lab as well. So you got all of your lecturing stuff. Like, so you had your 20 something hours that you had as a lecture, but you also get the lab portion. And so we were in lab, I think 4 days a week. Yeah. Like for like half days. And then the fifth day you were in lab in the morning, and then you went down to the clinic to do, prophies, which I think you guys did as well.
We were supposed to, but we didn't. And there's second years now are supposed to, but still not being allowed to. So maybe next year it'll go back to normal.
That's so hard. I can't imagine that. And like that's also like the worst, doing the prophies. It's so stressful. I remember the first time doing it and just being absolutely terrified. And like you're with another classmate helping you, and you both have no idea how to use Axiom or how to do anything on there. And so you're following they give you a sheet that has like the steps you're supposed to do. So that was the D2 year. And then we actually started in clinic in end of April. Because the D4s had technically graduated, and we had our D3 white coat ceremony, and we got into clinic, and so so I'm trying to think. So at the beginning of D2 year, we had a lot of fixed. We had a partial crash course, so we did all of our removable partial stuff, and then the next semester was all of just dentures, and then we started doing endo. Like we talked about, doing access preps and how they look different on different teeth and things like that, and then like more intense operative stuff. So we started doing like complex, like you have a kappa cusp, or like you have to do back-to-back, class twos, and how do you do it? How do you shape it? And so D2 year was like all of that. It was, it's just hellfire running down. It was so much, so quick. And then it kind of just threw into clinic. And my first patient was a perio patient, and we had never really talked about how to measure gingival margins to calculate, clinical attachment loss. Like I'm sure we talked about it, but like of all the things I was thinking about, was not perio was not one of them. And I remember just being absolutely terrified looking at this guy's mouth, and he had like pocket depths of like 5s and 6s, and I was like, what's going on? and like that same appointment, my first appointment, my friend had a crown prep. Right? He was thrust in the clinic. He's doing crown prep right on number 14. And it's like he's doing a crown prep on a maxillary molar, and he's never done this before. And so it was totally different. Like you kind of alluded to this about things being different depending on the student. But I felt fairly prepared with lots of things coming into clinic. Like I felt like I could do almost any class one. I felt pretty confident I could do a class one. I was a little terrified of class twos. I think I'm still a little bit terrified of class twos. But I was really scared of of endo. But I was really fortunate. I had an endo case early on with a patient that really needed it. And so she couldn't really get out of not doing it. And so it kind of thrust me into doing the endo. And so that's been really good for me, even though it was really hard. So I think overall the lab experience at Creighton was pretty good. There's some things I wish they had gone over more. Like, this is a controversial topic, but I actually wish they had gone over more perio stuff in lab, because I probably spent 30% of my time in clinic this semester doing either like scaling and root planing or like doing patients that have, like periodontal maintenance. So they've done, they've initiated their periodontal therapy and then have had to continue to do that. And so you're seeing them every 3 months. And like, so how do you go about doing that? And so I kind of wish we talked about that more. We never did. And so that's been like kind of like a fire hose, is learning all the perio stuff. And it's just been my case. Like I said, I have other friends that have done other things that have been a lot harder, right? But for me, it's like, I didn't really know perio. But now that I'm getting other things and they're doing the perio, it's kind of evening out more or less. But so I think overall it was a good experience. I really enjoyed the way we kind of did the lab stuff. I actually wish we did some lab stuff now. We actually don't go to the lab anymore. So like I heard you were mentioning that, like, I think some of your courses, you still go up to the lab.
Yeah, we did at the start of third year. So like the summer semester, we did endo and implants in the sim lab.
Okay.
But again, like we basically don't do endo, and then we don't get to place implants or anything. So it was just like conceptually for us to learn it and practice it, even though we're probably not going to do it ourselves. So it didn't really matter that we were already in clinic when we were taking the class and doing the hands-on, because we weren't going to probably do it anyways. So thinking about what you said, the main differences I noticed is we start sim lab right away when you start dental school. We start our pre-clinic, and you start with, they changed it now, and I think it makes way more sense. Now they start with class 5s, then class 1s. And I think that makes sense because class 5, you can like see everything. So that makes sense. We did class 1s, class 2s, class 3s, class 5s and 4s or something like that. So we did class 2s like second, because you already kind of knew the occlusal. Now you just drop a box. So easy. Not so easy. So they'll probably like,
yeah. Class 4 to class 5 are the same thing, so.
I know. So it was interesting, but I really didn't mind it though. But the big thing is like, first year you do cavity preps and fills. Second year, you never do those again. And then you start clinic and you have a patient to do a cavity prep on. So it's kind of weird. And then like our second year is crown and bridge, and then complete denture 1 semester, partial denture 1 semester. And then you start third year and start clinic. So that was like the big thing that I think is weird, that you don't like get a little bit as you go of everything. But I don't know. We had a lot of, I feel like thinking back, like we've had really strong fundamentals in terms of lectures. Like they've been very thorough and clear about everything, and very like repetitive. That's what stressed me out at first year, was like, how am I going to be a good dentist? Like there's so much information to know, and you just feel so guilty if you forget something, but we're still learning. But like, I was like, how am I ever going to be a good care provider? Like it isn't going to happen. What if I forget something? So I've noticed now, after 3 years of school, the important things they have probably told me genuinely 1,000 times. So like, I know the key things that I'm supposed to, and the other things that are maybe like level 2 and 3 of knowledge are also being repeated all the time. It's like the super obscure things I might forget and have to look up, but like they make sure that you know those essential things. And that made me feel better now looking back.
Well, I want to ask you a question, actually.
I think you're still muted.
Am I still muted?
Oh, now you're good.
Okay. So I want to ask you a question real quick. So yeah, so that's one thing I've learned. I feel like my D3 classes are essentially just D1 and D2, maybe a tiny bit more. But like we have operative right now, and it's essentially just like basic, pin placement is kind of what we're talking about, right? Or just like basic, like, okay, how do you create your walls when do you diverge or convert? It's like, we know this stuff. Is that how it is for you too? Like, it's just like more basic with the little things added on?
So I would say first year was all the same kind of classes you mentioned. Second year, we did like all the systems of the body. So kind of more like med curriculum in a way, but it was all like tied back to dentistry. But it was like every, nervous system, respiratory, GI, GU, all that. And then tied back to like occasionally, this can affect dentistry with this condition or this medication the patient be on. You'd want to look at this. So once you got through all of that, then we've pretty much been taking a class on like every specialty, like every semester. And then we have like our clinical credits. And that's really it. So there's like pretty much always like a perio, an endo, an ortho, peds, kind of everything that you do. And then like a fixed pros or like removable pros, like something kind of each discipline. And we just keep getting like more advanced, like you were saying, just going like into greater detail and reiterating a lot of the information. I guess we don't take endo and ortho like every semester, but we've had all of them multiple times. We've had like 3 pediatrics, 2 endos. We've had like 7 perio classes. We have perio like every semester. So when you were saying you don't feel like you knew 100% of perio, we went in on the perio for sure.
You know your stuff in perio. That's good.
Oh, your audio is out again. I don't know why.
Oh, sorry.
You're good. You're good now.
I should just wait a second. I think it needs to kick back in once I do. No, that's good. I'm glad you know your perio. That's good. Because I think they try really hard to prepare us, but it's just different. It's different, seeing it on a model than seeing
it's different from reading a lecture slide to doing something in person 100%. Like I was so ready to be done with sim lab. Like I felt like I'd practiced enough reps of all the things on the fake teeth. Like I just want to get in real patient scenarios because real people are so much more complex in all the different ways. I just need to practice on real patients. So that's where we are now. And it's like so fun. It's just clinic can be frustrating, as you know, in all the different ways, but like it's so nice just being in clinic. And like I feel like get really early clinical exposure, even though we're not doing like a advanced procedures. Like you start assisting your first year and you're up in the clinic like once or twice, like at least like 2 or 3 times a month from first year on. And then as you go each semester, they increase the requirements. Like now we have to assist. In theory, we're supposed to assist 3 times a week, which like there's not time to do that. Like
theory?
Yeah, like we're supposed to. I don't know how I'll get on. I usually am on top of it, but I've been busy with my own patients, so I haven't been assisting as much.
Yeah.
Basically, they want you there every single minute that the clinic is open. If you're not seeing a patient, they want you to assist someone. And I feel like that's been great getting exposure to like, maybe I haven't done it, but I can go sit with the whole procedure of someone doing something that I'm curious about. Or like we were learning all the denture stuff in lab and it like doesn't really make sense because you don't really have a real patient there and you're just reading slides or looking at a mannequin. But going to see border molding up in the clinic made it make a lot more sense. So because we have that flexibility to like pick and choose what we want to assist and like are forced to be assisting, I feel like I've learned a lot. But at the same time, seeing someone do something is a step beyond a lecture, but doing it yourself is what you really need. And that's where I'm still just patiently waiting my turn for a lot of things.
Well, I feel that way about dentures or even partials. I feel like, there are so many steps, right? Like in dental school, there are like, 8 appointments or something stupid, right? You have all these appointments in order to make sure everything's, set up correctly. And you get a good impression and you have to set the teeth. Anyway, so it's really tedious. And I wish almost that they had let me see someone do it. That like my D2 year or something, they would have been like, okay, so-and-so is doing a denture on this patient. Here are the appointment dates. You need to be at every single one so you can see this process. Like that would have changed my entire experience because I'm currently doing a denture for a patient, a denture over a partial. And I've never seen those 2 done together. So I have no idea how the process works together, right? Like I've seen them each done separately, but like how do you intertwine those? Like that's a nightmare. And so it's just one of the the lovely benefits of being in clinic where you're trying to figure out how to balance the entire world,
Mm-hmm. Definitely. Before we wrap up, because I don't want to keep you too late, do you have any other like things you were dying to share with people that you think is helpful for them to know?
I didn't share. No, I mean, I think it's good to say, but I think the biggest thing is I've been feeling very grateful recently with just the idea of dental school. I think, being a dentist is an amazing profession, and enables you to do lots of wonderful things, and enables you to change a lot of people's lives. And I think one of the reasons that I really have enjoyed it recently is because it's something that's so stigmatized. And I hate that word, but it is something that a lot of people will hate. I mean, you mentioned this. You have a patient that talks about, like, they hate coming to the dentist, and I totally understand why they don't like a dentist. I get it. Like, how the things I do, I cause you pain, and I'm aware of that. But I love being able to explain things to people, like why as a dentist I do this. I do this because of this, and it kind of sheds a little light on that. And I still think that dentistry is, the best profession. I still think that's, it's a wonderful path. One thing I've realized recently is that it's much harder than I thought it was going to be. And I think that's a really good thing, but it's also very intimidating. I was telling you this a little bit before, but I had the opportunity on this really young patient. She had a very deep carious lesion, and it got into the pulp. And so my doctor was like, okay, you're going to do the endo on her. And so I scheduled her to come back into the endo. And it was like, it was one of the worst experiences of my life. It was so hard. This is it's a molar tooth, had 4 canals, and really difficult for anyone that knows actually how to do endo. I'm sure if you're a real dentist, you're probably thinking, oh, not bad, done that before. But it was one of my first times ever doing endo, and it took 3 appointments, which is a nightmare. So it took 12 hours essentially of time to do this endo. And I remember one point I was when you do endo, you file the canal down to get to the apex of the root to find the working length, and then so you're using these files, and you're incrementally going up the size of the file to increase the width of the canal. And at one point, I kept bending one of the files. And if you've seen the files, they're just really thin things. The file bends really easily. If you put it hits the wall. And I was so frustrated. The file bent in half, and when it bends in half, it's done. Like, you can't use the file anymore, and you have to throw it away anyway. So the end of the equipment. And I remember taking the file and just like crushing the file in my hand, like dropping on the tray. And I was so frustrated. And I kind of took a moment, kind of said a little prayer, and I was like, okay, I'm gonna finish this. And I finished it up that appointment, and I was so just overwhelmed with how wonderful that felt, being able to actually do the certification. Like, this patient came in, she had a lot of pain. When I put the temporary restoration in her mouth after she had the pulpal exposure, she told me she had never seen the tooth fully intact. And like, I was like, oh my gosh, like, this tooth doesn't even look good. Like, wait till I put a crown on this thing. Like, it's so much better. So I just think there's a lot of opportunity to really change people's lives and to do really wonderful things if you are willing to put the time in to work really hard to do things. And it's frustrating with school. You want to do lots of different things, and school kind of holds you back because they're trying to make sure you don't do anything stupid. But I just getting more and more excited for the future and the opportunities that await us as we finish school and we are actually able to see more patients. And I'm really excited for when we're D4s, and school finally starts actually giving us things to do instead of just giving them to the D4s. But I'm just really grateful, and I'm grateful for the opportunity to come on and talk, and to you and to share my experiences. I think it's good to hear different experiences, good or bad, in order to kind of learn, what's out there. And Creighton dentistry is a profession that I think more people should look into doing. And it brings lots of satisfaction, but you have to be sure that you want to do it because it's a very niche thing that you're joining.
Mm-hmm. No, definitely. And I'm thankful for you being on here tonight too. Can you share if people have questions about Creighton or like moving states or having a family in dental school? Those are probably good things to ask you about. Do you have like a good way for them to reach out?
Yeah, I can give you my Creighton email address. I'm more than willing to respond to that. So it's just RAW, and that's 15497 at creighton.edu. And Creighton is CREIGHTON. Please feel free to reach out, ask any questions. Like I said, I'm moved from Utah, where my family, I grew up, to Nebraska. Have 2 kids, so I know how trying to balance that life is. And so I'm more than happy to help if anyone has any questions about it. I'm not sure I'm the greatest resource, but I'd be happy to help.
No, I'm sure you are a great resource. You have good expertise and experience to share. Just talking about your own life helps people more than I think people realize, because it just allows them to see ahead a little bit and gain some hope, I guess, for like things will work out. Everything will be okay.
Yes.
Awesome. Well, thank you so much for your time tonight. I hope you have a good one.